Hi, this is your student nurse Tania. I will be performing the different types of bandaging using a triangular, cravat, and roller bandage. A bandage is used for a variety of purposes. It could be used to support an injured body part, create a pressure over a bleeding wound, hold a dressing in place over a wound, or to secure a splint to an injured part of the body. Without further ado, let us start with the demonstration. As part of the nursing process, it is important that we start first with the assessment. Prior to applying the bandage, we must assess for the following first. Number 1. Inspect and palpate the area for swelling. Number 2. Inspect for the presence of and status of wounds. Number 3. Note the presence of drainage including the amount, color, odor, and velocity. Number 4. Inspect and palpate for adequate circulation, including the skin temperature, color, and sensation. Number 5. Ask the patient about any pain experienced, including the location, the intensity, the onset, and the quality. Lastly, number 6. Assess the ability of the patient to reapply the bandage when needed. For the planning, first, we must identify the patient using two identifiers such as the name and the date of birth or the name and the medical record number of the patient. Second, explain the purpose of the procedure to the patient. Third, make sure that the area to be bandaged is clean and dry. And lastly, fourth, prepare the equipment needed including the clean roller bandage of the appropriate material and width, safety pin, adhesive tape, or the special metal clips.
Place middle of base of triangle so that edge is just above the eyebrows and bring apex backward, allowing it to drop over back of head. Bring ends of triangle backward above ears. Cross ends over apex at occiput, carry ends around forehead and tie them in a square knot. Turn up apex of bandage toward top of head, and pin with safety pin or tuck in behind crossed part of the bandage. Drop apex of triangle over shoulder on injured side. Bring bandage down over chest or back to cover the dressing, so that middle of base of bandage is directly below injury. Turn up a cuff at base. Carry ends around and tie in a square knot, leaving one end longer than the other. Bring apex down and tie to long end of first knot. Place middle of base of triangle well up on palmar surface of wrist. Carry apex around ends of fingers, cover back of hand to wrist, and tuck excess fullness of bandage into small pleats on each side of hand. Cross each half of bandage toward opposite side of the wrist, then bring ends of triangle around wrist, tie ends in square knot. Center foot upon bandage at right angles to base, with heel well forward of base. Carry apex of triangle over toes to ankle, and tuck excess fullness of bandage into small pleats on each side of foot. Cross each half of bandage toward opposite side of ankle, then bring ends of triangle around ankle, then tie ends in square knot. After making a triangular bandage into a cravat of proper width, place it under the chin and carry ends upward with one end longer than the other. Bring longer end over top of head, cross both ends on side of head, and end should now be of equal length. Pass ends around head in opposite directions and tie with square knot on the other side of head on primary turn of cravat. Place cravat over dressing in armpit so the front end is longer than the back. Carry the ends upward, then bring ends cross each other over top of shoulder. Cross ends over back and chest respectively to opposite armpit. Tie ends just in front of an injured armpit. Anchor the roller bandage at wrist. Apply succeeding spiral turns up the forearm, with each turn overlapping 1/3 of preceding turn. Then terminate and secure just below the elbow. Anchor the roller bandage at wrist. Apply series of spiral turns around the forearm, then spaces should be between turns should be equal the width of bandage. Secure the bandage just below the elbow. Anchor bandage on hand with circular turns near ends of fingers. Carry obliquely across back of hand to thumb. Bring under thumb and across palm to back of hand. Carry obliquely across back of hand to bottom of primary turn and across palm. Follow with several similar turns, each one overlying about 2/3 of preceding turn on back of hand. After sufficient turns, terminate with circular turns around wrist and secure. Anchor bandage with circular turns around head. Continue obliquely down, across back of head, under ear, and obliquely up across bone and bridge of nose, joining primary turn. Continue around head to forehead, then obliquely down across bridge of nose and cheek to point below other ear. Repeat procedure, each circular turn and each oblique turn overlying upper 1/2 or 2/3 of preceding turn. Continue until eyes are completely covered, then apply circular turns around head and secure.
Now that I am done performing the selected bandaging techniques, I will proceed with the evaluation. First, we must examine the bandage part frequently for pain and swelling. Second, examine the adequacy of the circulation including the skin, temperature, color, and sensation. Then third, evaluate the client's capabilities regarding activities of daily living during the application of the bandage. Then lastly, we must not forget to document the site and type of bandage used. So that's it for today's demonstration of selected bandaging techniques using a triangular bandage and roller bandage. Again, this is your student nurse Tania. Thank you for watching and until next time. Bye!